Welcome to Wally's Nursing Vetoes. Welcome to part 1 of a 2-part series on pediatric nursing concepts as a review. This review is broken down into separate systems and is a brief discussion of key concepts for pediatric nursing students. Let's begin. Respiratory, upper respiratory tract infections. These encompass a range of conditions affecting the nasal passages, throat, and associated structures. Otitis media, characterized by middle ear inflammation, often presents with ear pain, fever, and sometimes drainage from the ear. Pharyngitis or sore throat can be caused by viral or bacterial infections and presents with throat pain, difficulty swallowing, and sometimes fever. Croup is characterized by a barking cough, stridor, and respiratory distress, often due to viral infections affecting the larynx and trachea. Tonsillectomy is a surgical procedure to remove the tonsils, usually indicated for recurrent tonsillitis or obstructive sleep apnea. Epiglottitis is a potentially life-threatening condition involving inflammation of the epiglottis, causing severe sore throat, difficulty swallowing, and respiratory distress. Respiratory obstruction can result from various causes, including foreign body aspiration, allergic reactions, or anatomical abnormalities. Lower respiratory tract infections. Asthma is a chronic inflammatory condition characterized by recurrent episodes of wheezing, coughing, shortness of breath, and chest tightness. Treatment involves bronchodilators to relieve acute symptoms, corticosteroids to reduce inflammation, and education on trigger avoidance and long-term management. Cystic fibrosis is a genetic disorder affecting the respiratory and digestive systems, leading to thick, sticky mucus production, recurrent respiratory infections, and progressive lung damage. Management includes airway clearance techniques, enzyme replacement therapy, and nutritional support. Neuromuscular, musculoskeletal disorders, acute injuries. Acute musculoskeletal injuries such as fractures and soft tissue injuries are common in children and can result from falls, sports-related activities, or trauma. Fractures may be simple or complex, requiring immobilization with casts or splints, or surgical intervention with internal fixation. Soft tissue injuries include sprains, strains, and contusions, often managed conservatively with rest, ice, compression, and elevation. Congenital skeletal defects. Congenital skeletal defects like clubfoot and developmental hip dysplasia result from abnormal fetal development and may lead to functional impairment if left untreated. Clubfoot is characterized by inwardly twisted or misaligned feet and is treated with serial casting followed by bracing or surgical correction. Developmental hip dysplasia involves abnormal formation of the hip joint, requiring early detection through physical examination and imaging studies and treatment with splinting or surgical intervention. Acquired musculoskeletal disorders. Acquired musculoskeletal disorders like scoliosis and osteomyelitis can significantly impact a child's physical health and quality of life. Scoliosis is a lateral curvature of the spine, which may require bracing or surgical correction depending on the severity and progression of the curve. Osteomyelitis is a bacterial infection of the bone, often resulting from trauma or hematogenous spread, requiring prompt diagnosis with imaging studies and aggressive antibiotic therapy, sometimes supplemented with surgical debridement. Cerebral palsy and muscular dystrophy. Cerebral palsy is a group of permanent movement disorders that appear in early childhood, resulting from abnormal brain development or damage to the developing brain. It can manifest as spasticity, dyskinesia, or ataxia, affecting motor function and coordination. Management involves multidisciplinary care focusing on mobility aids, physical therapy, occupational therapy, and adaptive equipment. Muscular dystrophy encompasses a group of genetic disorders characterized by progressive muscle weakness and degeneration. Duchenne muscular dystrophy is the most common form, typically presenting in early childhood and leading to muscle wasting, respiratory compromise, and mobility impairment. Management involves supportive care, physical therapy, and monitoring for complications such as scoliosis and cardiomyopathy. Endocrine manifestations and management. Endocrine disorders encompass a wide range of conditions involving hormonal imbalances that affect growth, metabolism, and other bodily functions. Adrenal hyperplasia refers to excessive growth of the adrenal glands, leading to overproduction of cortisol or other hormones. Symptoms may include weight gain, hypertension, and virilization in females. Management involves hormone replacement therapy or surgical intervention to remove adrenal tumors. Hypothyroidism results from insufficient thyroid hormone production, leading to symptoms such as fatigue, cold intolerance, and weight gain. Treatment involves thyroid hormone replacement therapy. Growth hormone insufficiency leads to short stature and poor growth velocity, often requiring growth hormone supplementation. Phenylketonuria, PKU, is an inherited metabolic disorder characterized by the inability to metabolize the amino acid phenylalanine, leading to intellectual disability if untreated. Management involves dietary restriction of phenylalanine and monitoring of blood phenylalanine levels, management and nursing care of DM and DKA. Diabetes mellitus, DM, is a chronic condition characterized by hyperglycemia resulting from insulin deficiency or resistance. Type 1 DM typically presents in childhood and requires lifelong insulin therapy, blood glucose monitoring, dietary management, and regular exercise. Diabetic ketoacidosis, DKA, is a life-threatening complication of DM characterized by hyperglycemia, ketosis, and metabolic acidosis. Treatment involves intravenous insulin therapy, fluid resuscitation, and electrolyte replacement. Nursing care includes monitoring blood glucose levels, administering insulin and fluids, assessing for signs of complications such as cerebral edema, and educating patients and families on disease management and prevention of DKA recurrence. Teaching plan for parents of a child with DM. A comprehensive teaching plan for parents of children with DM should include education on insulin administration techniques, blood glucose monitoring, carbohydrate counting, recognition and management of hypoglycemia and hyperglycemia, dietary management, exercise recommendations, and sick day management. Emphasis should be placed on the importance of adherence to the treatment plan, regular follow-up care, and prevention of long-term complications such as diabetic retinopathy and neuropathy. Genitourinary defining characteristics and management of GU surgical concerns. Genitourinary GU surgical concerns in children encompass a variety of conditions affecting the urinary tract and genitalia. Testicular torsion involves twisting of the spermatic cord, leading to ischemia and necrosis of the testicle if not promptly treated with surgical detorsion. Bladder exstrophy is a congenital anomaly characterized by the exposure of the bladder mucosa through a defect in the abdominal wall, requiring surgical repair in infancy. Epispadias and hypospadias are congenital anomalies involving malformation of the urethra, requiring surgical correction. Cryptorchidism refers to undescended testes, which may require surgical or hormonal intervention to correct. Diagnosis, nursing management, and anticipatory guidance of UTI. Urinary tract infections, UTIs, are common in children and may present with symptoms such as dysuria, frequency, urgency, fever, and abdominal pain. Diagnosis involves urinalysis, UA, urine culture, UC, and imaging studies such as ultrasound or voiding cystoarthrogram, VCUG, to evaluate for structural abnormalities. Nursing management includes administering antibiotic therapy, promoting adequate hydration, and educating patients and families on prevention strategies such as proper hygiene and voiding habits. Comparison of minimal change nephrotic syndrome and acute glomerulonephritis. Both minimal change nephrotic syndrome, MCNS, and acute glomerulonephritis, AGN, are kidney disorders affecting glomerular function, but differ in their underlying pathophysiology, clinical manifestations, and management approaches. MCNS is characterized by massive proteinuria, hypoalbuminemia, edema, and hyperlipidemia, with minimal changes seen on renal biopsy. It typically presents with generalized edema and responds well to corticosteroid therapy. On the other hand, AGN is characterized by hematuria, proteinuria, hypertension, and oliguria, often occurring after a streptococcal infection. It usually resolves spontaneously within weeks and may require supportive care and treatment of complications such as hypertension and fluid overload. Nursing care for both conditions focuses on monitoring fluid balance, nutritional status, and renal function, as well as providing education and support to patients and families. Diagnostic process for VUR and treatment with potential complications. Vesicoreteral reflux, VUR, is a condition characterized by the backward flow of urine from the bladder into the ureters and kidneys, increasing the risk of urinary tract infections and renal scarring. Diagnosis involves imaging studies such as voiding cystoarthrogram, VCUG, and renal ultrasound. Treatment options include observation, antibiotic prophylaxis, or surgical correction with ureteral reimplantation or injection of bulking agents. Complications of VUR include recurrent urinary tract infections, renal scarring, hypertension, and renal insufficiency. Nursing care involves educating patients and families about the condition, administering medications as prescribed, and monitoring for signs of infection or renal dysfunction. Neurological modalities for assessment of cerebral function. Assessment of cerebral function involves various modalities to evaluate the level of consciousness, neurological status, and signs of increased intracranial pressure, ICP. The Glasgow Coma Scale, GCS, assesses eye-opening, verbal response, and motor response, providing a quantitative measure of consciousness. Evaluation of posturing, such as decorticate or decerebrate posturing, helps assess brainstem function and localization of brain injury. Red flags for increased ICP include changes in level of consciousness, headache, vomiting, and papilledema. Nursing assessment involves frequent neurologic checks, monitoring vital signs, and prompt recognition and reporting of abnormal findings. Differentiation of seizure disorders. Seizure disorders encompass a range of conditions characterized by abnormal electrical activity in the brain, resulting in seizures of varying types and severity. Generalized seizures involve bilateral synchronous discharges and may present as tonic-clonic, grand mal, absence, petit mal, or myoclonic seizures. Focal seizures originate in one area of the brain and may present with motor, sensory, or autonomic symptoms. Status epilepticus is a medical emergency characterized by prolonged seizures or recurrent seizures without regaining consciousness between episodes. Management involves seizure precautions, administration of anti-epileptic drugs, AEDs, lifestyle modifications, and sometimes surgical intervention. Nursing care includes seizure monitoring, administration of medications, safety precautions, and education for patients and families on seizure management and prevention. Identification of structural defects and prevention. Structural defects of the central nervous system, CNS, and spinal cord can result from genetic factors, prenatal exposures, or developmental abnormalities. Examples include neural tube defects, e.g., spina bifida, anencephaly, hydrocephalus, and Chiari malformation. Prevention strategies include folic acid supplementation before conception and during early pregnancy to reduce the risk of neural tube defects. Prenatal screening tests, such as ultrasound and amniocentesis, can help detect structural abnormalities early in pregnancy, allowing for timely intervention or planning. Avoidance of teratogenic substances and maternal infections during pregnancy is also essential for preventing structural defects. Care plan for meningitis or encephalitis. Meningitis and encephalitis are inflammatory conditions of the meninges and brain, respectively, often caused by infectious agents such as bacteria, viruses, or fungi. Meningitis presents with symptoms such as fever, headache, neck stiffness, and altered mental status, while encephalitis may involve additional neurological symptoms such as seizures and focal deficits. Diagnosis involves lumbar puncture for cerebrospinal fluid analysis and imaging studies to identify the underlying cause and extent of inflammation. Treatment includes antimicrobial therapy for bacterial meningitis, antiviral medications for viral encephalitis, supportive care, and management of complications such as raised intracranial pressure. Nursing care focuses on monitoring neurological status, vital signs, and fluid balance, administering medications as prescribed, providing comfort measures, and educating patients and families on disease management, including the importance of completing antibiotic or antiviral therapy and recognizing signs of complications. Preoperative and postoperative care of a child with hydrocephalus. Hydrocephalus is a condition characterized by an abnormal accumulation of cerebrospinal fluid, CSF, within the brain ventricles, leading to increased intracranial pressure, ICP. Preoperative care involves preoperative assessment, including neurological evaluation, imaging studies, e.g. MRI, CT scan, and laboratory tests to assess baseline status and identify any comorbidities. Nursing interventions focus on maintaining optimal neurological status, monitoring vital signs, and administering prescribed medications such as diuretics or anti-epileptic drugs to manage symptoms. Postoperative care includes monitoring for signs of increased ICP, e.g., changes in level of consciousness, headache, vomiting, wound care, pain management, and rehabilitation support. Nursing education includes teaching parents about signs of shunt malfunction, infection prevention strategies, and follow-up care. Cause of Reyes syndrome and strokes in children and nursing management. Reyes syndrome is a rare but serious condition characterized by acute encephalopathy and liver dysfunction, often occurring after a viral illness such as influenza or varicella, and associated with the use of aspirin during the illness. Clinical manifestations include vomiting, altered mental status, seizures, and signs of liver failure. Nursing management focuses on supportive care, including close monitoring of neurological status, vital signs, fluid and electrolyte balance, and liver function tests. Prevention involves avoiding aspirin and salicylates in children with viral illnesses and using alternative antipyretic agents such as acetaminophen. Strokes in children may result from various etiologies, including congenital heart disease, sickle cell disease, or vascular anomalies. Nursing management involves rapid recognition and assessment of stroke symptoms, collaboration with the healthcare team for diagnostic evaluation, e.g., imaging studies, acute interventions such as thrombolytic therapy or surgical interventions, and rehabilitation support to optimize functional outcomes.